the ill effects, the disadvantages of smoking. Meharry has a relationship with Head Middle School, and we have had children do posters about why not to smoke. We have given prizes, and the kids are really beginning to understand the reason why they should not smoke. Hopefully that will follow through to their adult behavior, that they don't need to feel grown by smoking, that you feel grown by taking responsibility for your own health status. And we find that very, very encouraging. So this is something that the schools can do. They can promote positive lifestyle changes even in grade school children.
Very good. And Doc, what about your study? Did you investigate physicians and smoking in your study? And if so, what are some of the things that you can reveal to us about it from that perspective?
Well, Ms. Thomas can probably give you better information. She's been interested in smoking pattern in physicians, and so she's
very good.
Well, when we first started the study in 1958 to 1965, we did, like Dr. Thomas said, a comprehensive intake of all types of data, and we found out that 78% of all the students that we were examining smoked, and they were smoking 1 to 2 packs of cigarettes, well, a pack of cigarette a day. We did another examination in about 30 years later, and we found that the trend had reversed entirely. Only 25 to 30% of the guys were smoking. So that was good. I mean, from the public education, we've seen that. And we're doing a study on freshman medical and dental students now in 1991, and we have found that only less than 5% of them are smokers. So we do see some, at least in this particular population, we do see some impact being made on that negative health behavior.
I think we still have a problem of affecting behavioral changes in blacks, because we compared our study with a similar study of white physicians, and we found that initially, whereas 78% of our people were smoking, only 32% of the white students were smoking. And,
but the interesting fact there was that they may have been smoking, the whites were smoking, but they were smoking more cigarettes. Our guys who were smoking had been smoking and started smoking at an earlier age, but they were smoking fewer cigarettes per day.
So affecting behavioral change, and also access to medical care. Now we found out in our Meharry cohort study that even though physicians have access to medical care, it takes them longer to actually get to a doctor to take care of a symptom that they have than it does in the white cohort. And I am not so sure what that type of behavior is concerned. We see it in other, for instance, we know that as far as seat belts are concerned, black wear fewer seat belts than whites. That type of behavior, I don't know how to explain that.
So there's, in other words, there are some things that people simply have to do for themselves.
Right.
Exactly.
You can only make them aware of some of the problems that we're that are associated with it, but when it comes to heart attacks and how to prevent heart attacks, they have to
take charge. I mean, you have got to become accountable to yourself for yourself. When you go into, even with patients seeing physicians, the physician is not going to cure you from this disease. You have got to take the medicine. You have got to make that decision to do something to help yourself. And that's what we're seeing now with the practice of medicine, is empowering, enabling patients to take responsibility for their own health status. And if you have any problems with your medicine, don't stop taking your medicine. Tell the physician what your problem is, and then they can give you a different type of medicine, or ask you, just what is it that your problem is, and give you something else to take besides that.
Very good. Dr. Thomas.
I was about to say maybe we should talk about some of the symptoms of heart disease. Now, as far as high blood pressure is concerned, we know that it doesn't produce any symptoms. Once high blood pressure starts producing symptoms, then it's far advanced. But a person can have hypertension, high blood pressure for years and years, and it doesn't cause any pain or anything. And that's why we call it a sneaky disease, because it sneaks up on a person. And when a person starts having trouble, he already is. So getting regular physical examinations, that's the only way you can tell whether or not your blood pressure is elevated. So a person should have physical examination at least once a year. Now, as far as having heart attacks, there are signs that will tell a person that he is nearing a heart attack, or symptoms of a heart attack. Probably the most common is chest pain. And we found out that talking with a lot of our patients, we would ask them if they had chest pain, and they would say, no, I don't have chest pain, but I hurt. So you have to talk that person's language, and maybe that's the reason that people didn't pick up the idea that blacks were having angina, and blacks, because taking time to get a good history and everything. And we remember that we can think about people in the community who died of an attack of acute indigestion. Well, they died of a heart attack, and that mimicked. So anytime a person has any pain in his chest, he should see a physician to be sure that it is not a heart attack.
Or just fullness in their chest.
And maybe complain of fullness or tightness or any discomfort in the chest. The worst thing that could be is that it's a heart attack. And that can be prevented or altered to keep from producing sudden death. So that's very important that a person should see. And there are simple things that can be done.
And of course, Doctor, we've got, let us wrap it down here and again remind our audience that on the last Saturday in this month, that the Meharry Forum will concentrate upon cardiovascular diseases and heart attacks and that kind of information, and we want to encourage all of the people to come out at that time at 11 o'clock to talk about with physicians and to take tests and whatnot, and that this is something that's sponsored by Meharry Medical College for the community. And let me thank both of you for coming by, father and daughter team, for giving us this information today. And let me encourage you to tune in again next week for another informative edition of Comments. Thank you and good morning.
17.